One of the most common questions that I get asked by patients is, what is a stroke? What are the signs and symptoms? And what can I do to recover completely from a stroke? Well, in this video, I'm going to answer all those questions and more. So let's go ahead and get into it. Hi everyone, I'm a doctor. If you like medical topics and learning about your body, then make sure to subscribe to my channel. So let's start off with, what is a stroke? A stroke happens when there is an interruption of blood flow to a certain part of the brain. This can be caused by either a blockage in a blood vessel or the rupture of a blood vessel. Either way, there is an interruption of blood flow and oxygen to a certain part of the brain, and when that part of the brain does not get blood and oxygen, it can cause permanent damage. There are two main types of strokes, ischemic and hemorrhagic. An ischemic stroke is when there is a blockage in one of the blood vessels in the brain. This blockage prevents oxygenated blood from getting to a certain part of the brain, and that part of the brain can become damaged from lack of oxygen. The good news is that most strokes are ischemic strokes, and therefore there are treatments available to help break up the blockage and restore blood flow to the brain. A hemorrhagic stroke is when there is bleeding in the brain. This can be caused by an aneurysm or high blood pressure or taking blood thinners or even unplugging an artery that has a blockage in it. When there is bleeding in the brain, it can put pressure on the brain and cause it to swell. This type of stroke is more serious than an ischemic stroke, and unfortunately, there is not much that can be done to stop the bleeding once it starts. Now, what are the signs and symptoms of a stroke? It's important to know the signs and symptoms of a stroke so that you can get help right away. The faster you get treatment after a stroke, the better your chances of making a full recovery. The most common signs and symptoms of a stroke include numbness or weakness in the face, arm, or leg, especially on one side of the body. Difficulty speaking or understanding speech, sudden confusion or trouble with memory, loss of balance, dizziness, or difficulty walking, severe headache with no known cause. There is also a really easy way to remember the signs and symptoms of a stroke. It's called FAST. So F stands for facial drooping. Does one side of her face droop, or is she smiling weakly? A is for arm weakness. Can she raise both arms equally, or does one arm drift downward? S stands for speech difficulty. Is her speech slurred or strange? And T stands for time to call 911. Every minute that goes by during a stroke, 1.9 million brain cells are being damaged. That's why it's so important to call 911 right away. Now we know the signs and symptoms of a stroke. Let's talk about what you should do if you have them, or if you see someone having them. The first thing you should do is call 911. Even if the symptoms go away, it's still important to seek medical attention. You may have had a transient ischemic attack, which means that the symptoms will go away by themselves, but it can be a warning sign of an impending stroke. Once you get to the hospital, the doctors will do a number of tests to figure out what's causing the stroke. They will do a physical exam and ask you questions about your symptoms. They may also do a CT scan or MRI of your brain to look for any signs of bleeding or a blockage. If it's an ischemic stroke, there are a number of different treatments that can be used to break up the blockage and restore blood flow to the brain. One of the most common treatments is a medication called tissue plasminogen activator. This is a clot buster that can dissolve the clot blocking the artery. However, this medication must be given within 4.5 hours of the onset of symptoms. There are clinical trials looking at extending that window out to 24 hours, so stay tuned for future updates. Another treatment that can be used for an ischemic stroke is a procedure called mechanical thrombectomy. This is when a catheter is inserted into the blood vessel and a device is used to pull the clot out of the blood vessel. This procedure can only be done in certain cases and usually requires a longer window of time from the onset of symptoms. If it's a hemorrhagic stroke, there are no medications that can be given to stop the bleeding. The best treatment is often to just let the bleeding stop by itself. In some cases, surgery may be an option to stop the bleeding and remove any blood that has accumulated in the brain. No matter what type of stroke you have, it's important to get treatment right away. The sooner you get treatment, the better your chances are of making a full recovery. Now let's talk about what you can do to reduce your risk of having a stroke. There are a number of things that you can do to reduce your risk of having a stroke, including eating a healthy diet, exercising regularly, maintaining a healthy weight, not smoking, and managing any other medical conditions that you may have. When it comes to diet, there are a few things that you can do to reduce your risk of having a stroke. First, eat plenty of fruits and vegetables. Fruits and vegetables are packed with nutrients and antioxidants that can help protect against stroke. Aim for at least 5 servings of fruits and vegetables per day. Second, choose whole grains over refined grains. Whole grains contain fiber and other nutrients that can help keep your blood pressure in check and reduce your risk of stroke. Third, limit your intake of saturated and trans fats. These types of fats can raise your cholesterol levels and increase your risk of heart disease and stroke. Fourth, limit your intake of sodium. High levels of sodium can raise your blood pressure, which puts you at increased risk for stroke. And finally, don't forget about the healthy sources of protein. Protein is essential for maintaining muscle mass and strength, but you don't need to get it from red meat. You can get plenty of protein from plant sources such as beans, lentils, and tofu. Exercise is also important in reducing your risk of stroke. Exercise can help lower your blood pressure and improve your overall health. Aim for at least 30 minutes of moderate intensity exercise most days of the week. If you found this information useful, please leave a like. Also, if you have any questions, please leave them in the comments below. I will be happy to answer them. Thank you for watching and take care.